Hi everyone, my name's Lowe. I'm an acupuncturist, Tuina massage practitioner and researcher. In this video, I'm going to give you my top 10 reasons why acupuncturists should consider learning Tuina massage and adding this to your game if you're not already doing so. Number 1. Musculoskeletal issues. There is pretty good evidence that Tuina massage is a safe and effective treatment for a range of musculoskeletal issues. Now, with most patients seeking acupuncture for some form of musculoskeletal pain, it's really good as a practitioner to have this additional modality to offer to these patients. Number 2. Combinations. There is a body of evidence that suggests that Tuina therapy plus acupuncture is more effective than acupuncture alone for some conditions. And no, these aren't just musculoskeletal issues. Acupuncture combined with Tuina could significantly increase the therapeutic effect of acupuncture in migraine treatment. The results of this meta-analysis indicate that acupuncture combined with Tuina can significantly improve and shorten the cure time of peripheral facial paralysis compared with acupuncture only. Another meta-analysis suggests that the combination of acupuncture and Tuina showed obvious clinical advantages in the treatment of insomnia. And finally, a randomized controlled trial showed acupuncture and Tuina elicited a more efficacious effect than acupuncture alone for chronic fatigue syndrome. Number 3. Contraindications. Non-invasive acupoint stimulation, such as with acupressure and Tuina, is a really good option where you can't needle directly an affected limb because they've had their lymph glands removed, perhaps they've got severe diabetic neuropathy or another condition where direct needling carries a slightly increased risk of infection. Number 4. Needle phobias. Some patients really want to try acupuncture, but they're just too afraid of needles. Now, having acupressure and Tuina as an additional option to offer these patients is so helpful. Here are some results from a case where I used acupressure and channel massage for a lady with quite severe menopausal symptoms and insomnia. The patient reported significant improvements at 4 weeks, and these were sustained at 3 months with a course of 10 treatments. Number 5. Palpation and diagnosis. Massage is a great way to gather more diagnostic information via palpating a patient's body. Not just necessarily for musculoskeletal issues, but also for identifying sensitized reflex areas for a range of internal issues. Applying Tuina techniques can also engage you and your patient in a direct ongoing feedback loop, where you can constantly gather more information as you're palpating and massaging the patient's tissues, and this can be so useful for allowing you to be flexible and really adapt your treatment as you're going on. Number 6. Anatomy and point location. By learning and regularly applying Tuina massage in your practice, you are going to improve your knowledge of anatomy and your point location skills. Acupuncture channels and points often follow key intersections, contours and boundaries of important muscles and joints. Tuina massage techniques often follow these anatomical features as well. Tuina teaches you more individualized point location, where you can palpate the exact point on an individual's body rather than relying on where the textbook says that point should be. Number 7. Therapeutic touch. Research is increasingly showing just how important therapeutic touch is when it comes to health and healing. It can help strengthen the therapeutic alliance between practitioners and their patients and help lead to more successful clinical outcomes. Number 8. Tuina massage just intuitively feels really good. But more than that, the relaxing benefits of massage, getting people out of that stressed sympathetic dominance fight or flight state and into the parasympathetic nervous system state, is so useful to do, especially before acupuncture. Often patients can be stressed and tense before they receive acupuncture, and they might be a little bit nervous of direct needling. So applying massage before acupuncture treatment can be such a great way to help get patients in a good headspace physically and mentally before you move on to direct needling. Number 9. Following on from the last point, by applying Tuina massage techniques to the soft tissue in the local area of a point directly before you needle can really help loosen up these tissues, avoiding a nocebo response and avoiding pain when you're needling a patient. Number 10. This doesn't have anything to do with the treatment itself, but by adding massage therapy as an additional service you provide, you will be diversifying your marketing potential and allowing yourself to reach more and more people. Thank you very much for listening, everyone. If you are interested in learning some Tuina massage techniques to add into your existing acupuncture practice, then I'm delighted to be offering a new Tuina postgraduate diploma course with East West College starting this November 2024 in Exeter in the UK. For more information about the course, please see the links in the video description below.